So in this section, we're going to talk about renal system. Actually, we're going to talk about reproductive system as well. But for now, we're going to focus on renal system. So here you can just see kidney. We have two of them. On top of that, we do have a hat. I guess you remember that. What was this gland's name? And you better should just remember that because like I'm gonna do some sort of throwback questions, which gonna be about your part one. So just make sure you're gonna understand the whole chapter's material to just be able to do the quiz. But yeah, back to the renal system, we do have two kidneys, then we do have a bladder, and at the end we do have urethra, which is actually the length of it is just different from gender to gender. For example, in men, it's just longer than in women because of their reproductive system and like their body's structure. But what is urethra's responsibility? It is like basically a tube-like structure in the human body that can be like a passage for urine to just get out and just be expelled from the body. A funny story is whenever I was in high school, I had like biology class, and like you all know that like in biology class you do have like a lot of content about renal system, reproductive system, and all that. Since I was like that kind of, I would say like crazy student back in my high school, I was just very popular and all that. But besides that, I was just very like naughty, seriously. Like I would just say something and the whole class would just, would be a chaos. But long story short, whenever the instructor would just teach that kind of content, my friends and I we were just joking and like pranking and all that. And I feel like this is like God's lesson to make me to teach the same stuff. Seriously, which is crazy. Because like if someone would just lecture this, I would just giggle all the way. I know it just sounds crazy and we are adults, but still this is me. But yeah, it's about me. I'm not sure if you are smiling now or if you are just laughing to the whole content, but yeah, it is what it is. So here you can just see like the whole system. Let's go and just take a look inside and talk about each parts of renal system's responsibility. Like the main part gonna be kidneys. They are vital, they are very important because they do have important responsibilities. First of all, they're gonna balance your blood. It can help you a lot to just balance like your blood pH or get rid of some sort of acid base contents in your blood. Or maybe it can just help your blood to just be detoxify. Also, it is very important for waste elimination. It's actually like the kidneys, they're gonna remove excess substances such as ammonia, drugs. I mean, don't do drugs, but they actually get rid of drugs and other waste products. It's gonna just help our body to just get rid of any sort of excess substances, and they're gonna actually bring us urine, which is just very important. So then we have like bladder, which bladder is just very important too, because actually it just like just imagine bladder as a store or like storage actually that's gonna help us to keep urine, save it for a time. Then I mean you know the rest better than me, then you feel like you should check the bathroom and you're gonna go to the bathroom. So this is like the whole idea of renal system. What is renal system used for? Main part of that is just it can help us to maintain our water balance or blood pH or electrolytes, like all of that. So they are very necessary to just get rid of waste and all that. Disorders of renal system. Um, so first of all, it's gonna be urinary tract infections. Yeah, which is not good. Then we have like nephritis, which is also very important. It's a whole different story, but read about this from your textbook. But I would say the main disorder in the renal system that I hope you wouldn't be familiar with that, but it is like kidney failure. It's just very important because kidney is just vital organ. So if you have any problem with your kidney, or if you are just experiencing kidney failure, you need either kidney transplant, or transplant actually, or artificial kidney, or dialysis, which all of them, they are just a lot of work. And I mean, yeah, it's just very hard for everyone who is just experiencing that. I'm just taking a pause because I'm actually trying to, because I do have some friends, they are experiencing kidney failure and I can see their pain. So I hope everyone who is sitting here and listening to me, they wouldn't have, or they wouldn't experience that kind of difficulties. But the good news is technologies nowadays, they're going to help us a lot to just cleanse our blood and remove excess salts, water, and like that kind of technology can help a lot to just, I wouldn't say they're going to substitute for the kidney, but they can just help us to just overcome that kind of discomfort and just at least just be better and just, live with the problem that we have. And I hope that the technology would be better, I mean, soon, because like with AI and all we have, I feel like we can just get more uh, to just address some sort of serious, painful problems like this. So now let's talk about reproductive system. It's very important because it actually help a human being to just stay in the planet and do more crazy stuff with the planet. But like you can see here, we have male, we have female, and as you probably know better than me, male and female, they are different when it comes to reproductive system. For example, for women, we do have like different parts. Um, but the end goal, oh, my Mac is again dying. But the end goal here is just producing ovum. And the end goal of like reproductive system of male is just producing semen. So, uh, what is ovum? The question is that we're gonna have at least one. Yeah, like normally, like everybody, like every women, they do have one by each month, and that's the whole idea of menstrual cycle. If the ovum would be fertilized by a sperm, it can develop to a human being. If not, it's gonna flush out. And that's like the whole idea of menstrual cycle again. So there are gonna be two hormones that gonna be involved in the whole procedure. It's gonna be estrogen, which is actually developing secondary sex characteristics, and they're gonna be progesterone, which gonna be like during your second half of period or menstrual cycle. So it's gonna get declined if pregnancy fails. I would ask everyone, especially guys, to pay close attention to these two hormones. I know that like there are like I supposed to add like some pictures here, but I know like the whole idea of menstrual cycle or period in women, it's getting better, but like it used to be like kind of funny thing that gonna happen to women. It's not funny at all because it just directly impacts women's mental health. And I would just say that policymakers, instructor, people in education, workforce, they have to just consider women and like their cycle as something necessary, because like it just definitely gonna impact women's performance during a month. And I would hope like as we actually trying to just have some progress in different aspects like technology, there would be some like understanding about women's situation when it comes to their circle. So let's talk about men and testes. I mean, like the whole system is just all about testes, because it's gonna produce testosterone, which gonna like yeah, it's gonna be testosterone, and it's just all about the idea of production of sperm, which gonna pass it through the uterus, and it's gonna cause I mean, it's gonna fertilize the ovum. It's also responsible for developing secondary sex characteristics. Disorder of the reproductive system. First of all, STD or sexually transmitted disease. I guess you're familiar with that. and you should be familiar with that. I know that here in the US, there are like so many classes related to that. And to be fair, I mean, I lived in different countries, and I know that like here, just the situation is very good. At least it just, I wouldn't say like perfect, but it's just good because at least people know about SCD. But you have to take your own life's like initiatives and go and get tested. I would like, even though you are not sexually active or something like that, you have to go and get tested because you might get the problem from someone else, and it's not only about like the sexual activity. It might just come in another way. So I would just suggest everyone would just go and get tested every 6 months. And if you are active, just do that more often. Because if you would just address that in the beginning, you can just help yourself to just be more healthy. Because like it's just very important. If it just develops, it's gonna actually cause like very serious problem like cancer, which we don't like that. The other problem gonna be disorders related to menstrual cycle. We don't like that at all. Like PMS and other problems for women. I mean, PMS is just bad. It is sad. But some women, they're gonna get like very serious problem, like very serious depression that's gonna cause them to just commit suicides or like something like that. And this is very serious because like previously, they wouldn't let women to just express themselves whenever they are experiencing severe PMS problems, but nowadays it's just getting better, and I'm hoping that it would be better and better every day. But the last one gonna be fertility problems. Fertility problems can be in men and women, both of them. And in developmental psychology, like the course that I was teaching during the past semesters, we talked a lot about this. We actually mentioned that even the underwear that you're gonna like wear every day can impact your like the possibility of your fertility every month. For example, if men they are just wearing boxer or like something like that, it can actually directly impact semen production during each month or probably every day. But yeah, like or the diet that you're gonna have, it can just impact fertility and all that. So you have to be really careful if you want to have children, or even if you don't want to have children. Again, fertility problem just very serious. So I'm going to talk more about another system in chapter 4.